Hi and welcome back to Antai Hospital's YouTube channel, and today we'd like to continue on the discussions on late miscarriage causes and treatment. Now, our previous videos we've been discussing cervical insufficiencies and how we treat it. Today we'd like to talk about another cause for late miscarriage, which can be prevented, can be diagnosed and treated here at Antai Hospital with our specialized treatments. So today's topic is short cervix, closely related to cervical insufficiency because the treatment is quite similar as well, and they lead to the same things, which is late miscarriages, and they happen on the same area as well. Cervical insufficiency is basically weakness or some deficiency, abnormality of the cervix, causing muscle to prematurely dilate before the pregnancy is fully mature, leading to miscarriages. Short cervix functions very similarly. They also happen on the cervix, but because the cervical length is far too short, it could be for several factors, usually congenital or acquired. Either you're born with this short cervix or you have gone through some procedures, some accidents leading to this shorter cervix. Now, there is a rate criteria that we can assess on the length, but if you have a short cervix, this can definitely lead to a late miscarriage because the dilation, the strength of the cervix depends on the length. If the length is far too short, it is not able to withstand the pressure of the fetus, especially when it's growing and growing in the second and third trimester, leading to premature birth or a late miscarriage, which is unwanted. So very similarly to how we treat cervical insufficiency, here at Antai Hospital for the treatment of short cervix, once it's properly diagnosed, we simply use two anti-cervical ring. We know this as our double anti-cervical ring procedure for short cervix. Only short cervix requires two double anti-cervical ring. And where do we place it? We place one in the outer orifice and one in the inner orifice of the cervix. This can effectively lengthen the cervix. Now, there are some patients who come to us who have gone through a cervical colonization because they have either cervical cancer or cervical pre-cancer. They need to remove part of the cervix. Some of them remove so much of the cervix that there's very little left. So how do we treat these types of patients if they want to go for pregnancy? Because very likely if they don't treat it, it will end in a miscarriage. So for these types of patients, when most of it has been removed, then we need to use parts of the uterus, the ones that are connected directly above the cervix, and then we need to use that as part to structure a new cervix, an artificial cervix, where we need an effective length. So let's say there's only very little length left, very little effective length of the cervix, then we need to use part of the uterus that is directly above, and then we need to secure the second ring there, and then the first ring is directly in the remaining of the cervix. Now, for these types of patients, it is extremely rare for it to be in this type of criteria, in these types of conditions, but it is in fact treatable. However, we still need to have you monitor this patient, and this surgery needs to be done using 3D laparoscopy. No other way can be accepted, only 3D laparoscopy, and we need to secure these two rings, and also we need to determine the exact length that we need and how much of the uterus that we are going to use as well. So some of you may think, does this affect the pregnancy if we use part of the uterus to construct new effective cervical length? Does it affect blood flow? Well, you need to understand that the uterus is made of abundance of smooth muscles and they are very elastic. So if you're worried about if it affects the pregnancy, not to worry at all. It does not affect. You can compare it with how some women can have large gestational size babies and small gestational size babies from the same uterus. It means the uterus can sustain several times its volume and it can expand several times its size as well. So there is no issue in affecting fetal development. And also, it does not affect blood flow, not to worry. These two factors are then eliminated. However, for these types of situational conditions, there needs to be a period of observation 1 week after the surgery. For those who have simply short cervix but not too, they still have remaining parts of the cervix that we can secure both rings, then not to worry. for your case, you will have high success rates. Not to worry at all. And patients also wonder whether or not we can do a contractual treatment for this as well. And yes, regardless of what type of situation you are under in, if you have a short cervix, we can have it treated and we can offer you full refund guarantee as well. If you still miscarry, then we offer you full refund of treatment costs. However, this procedure cannot be done during the midst of pregnancy. It can only be done before pregnancy. So please plan ahead, have yourself diagnosed, and get the treatment that you need if you do have a short cervix. And if you'd like to seek treatment with Antai Hospital, you can get in touch with us as soon as possible, and this surgery can be done within a week of hospitalization, and you can go home to recover and quickly go into conceiving. One ring in the outer orifice and one ring in the inner orifice, and you are guaranteed to have a successful pregnancy with Antai Hospital. So if you'd like to find out more information on our double anti-cervical ring procedure for short cervix in the prevention of late miscarriage, please visit the website and also talk to our consultants, and we can arrange a consultation or for you to directly receive this treatment today to secure you a healthy pregnancy. Late miscarriages are indeed preventable, so don't blindly go for your next pregnancy without proper treatment first if you do have a history of such miscarriages. So I hope you've learned something in this video, and please leave me some feedback down below and stay tuned to the next video.